Spinal stenosis. Introduction. Spinal stenosis is the narrowing of the spinal canal and foramina, which are the openings that nerves pass through. Select true or false. Correct. Central stenosis is narrowing that happens inside the spinal canal. Foraminal stenosis is the narrowing of the windows through which nerves leave the vertebrae of the spine. Most cases of spinal stenosis are a combination of both. Lynn has been having pain in her lower back. Today she lost control of her bladder and lost feeling in her right leg. Should Lynn contact her healthcare provider? Select yes or no. Correct. Lynn should contact her healthcare provider right away. Spinal stenosis is most common in men and women over 50 years old. Select true or false. Correct. Changes that happen in the spine as people get older are the most common cause of spinal stenosis. These changes can put pressure on the nerves in the spine. Is surgery always the first treatment for spinal stenosis? Select yes or no. Correct. Unless symptoms are severe, non-surgical treatments are often tried first. If non-surgical treatments do not work, surgery may be needed. Thank you for using Explain.